Hey, welcome back, everybody. It's that time of year when kids are going to be getting into sports, and really they do it year-round these days. So that means sports physicals, and sometimes it means more sports injuries. So we have Dr. Jacob Woods here this morning with Family Medicine. Good morning. How are you?
Excellent, sir.
You see a lot of kids, don't you?
We do. There's a lot of kids every day.
You're out in the Mesa area. What's the name of your practice out there?
Desert Grove Family Medicine.
So what do you suggest? I guess kids have to get physicals, right, before they do sports?
Yes, it's a state-required activity. They're required to have a physical before they participate in their regular sport activities at school.
What ages are we talking about?
For most part, it's high school kids, so starting at 15 all the way to 18.
Yeah, and what kind of things do they do in that physical that you guys run?
So the big thing is it's an overall where we take a look at their past medical history, talk to them about their family history, and then we do a comprehensive exam to make sure that they don't have anything that would disqualify them from being able to participate.
What about past injuries? As long as they're healed, they're good to go?
As long as they're healed and they've had the proper rehab, then they're ready to go.
Yeah, what kinds of injuries do you see with the kids mostly these days?
A lot of concussions. We also have a lot of sprains, strains, and then other medical problems they have dealing with asthma that can affect their ability to participate in sports.
Obviously, the big talk has been with concussions over the past few years, much more serious than a sprain or maybe a broken ankle. What do you do about those if they want to keep playing sports and they've had one before?
Well, immediately after the concussion, they will be out for a period of time and evaluate them to wait until they return back to their normal baseline. Once they recover from the concussion, then we monitor them, and when they're ready to play, then they can be returned to play, as long as they're not having worsening concussions.
Yeah, is that okay to continue playing if there's no lingering problems?
As long as they've had one or two, they're okay to continue playing. Now, if they continue to have them, they're more frequent, then sometimes we have to keep them out of contact sports.
A much different scenario in that case. What sports do you tend to see more concussions from?
Oh, definitely football.
Football?
Definitely.
But I hear that soccer players can get it. I mean, really, you can get it doing anything, right?
Yes, I've actually had concussions from soccer. I've seen cheerleaders that have them. I've seen just about any sport you can get a concussion.
Really?
Yes.
Wow, that's amazing. Are we making headway with concussions, do you think?
I think we are, that by having education to let people know that they need to stay out. That was something that wasn't done probably 10, 15 years ago. They weren't keeping athletes out. I think by now keeping them out and letting them recover, I think it's actually preventing further complications in the future.
What if somebody gets hurt in a sport and it's a head injury, but maybe they don't think they have any issues right afterwards, but then they go home? What should parents watch for?
Parents should watch for, typically they'll have headaches that worsen. Sometimes they'll have dizziness. A big one is they'll have confusion. Sometimes their emotional state will also be changed. And if any of those happen, they should see their doctor right away.
Okay. Well, coming up in the next hour, we're also going to talk to Dr. Woods about the fact that kids play sports year-round, really, in different sports. So that probably presents more issues in terms of injuries and things like that. So we'll talk about that next hour, and we'll take a break here on Good Morning Arizona and come right back after this quick break.